Okay, now we're going to demonstrate our ultrasound of the heart. You're going to select your phased array probe. This is a small footprint, so you can shoot in between the ribs. We're going to start off with the subcostal view of the heart. This would be a subcostal 4-chamber view. Position your hand more on the top of the probe so you can push the probe down into the skin, and this will enhance your view. This is in the standard cardiac orientation. The probe indicator is pointed to the patient's left. This is called the 4-chamber view because you can see the 4 chambers from the subcostal position. From the subcostal view, you can see the liver in the near field, followed by the right ventricle, and then the left ventricle. Fanning more towards the base, you can see the right atrium and the left atrium. If you look over at the right atrium, you can see the inferior vena cava positioned here, leading into the right atrium. You can turn this into a short axis view of the heart, and thus a long axis view of the IVC, simply by rotating the probe indicator towards the ceiling. To acquire the parasternal long axis view in standard cardiac orientation, you're going to place the probe in the parasternal location as shown here. Probe indicator will be pointing towards the patient's right shoulder, and you may have to fan up or down to optimize the image. It also may be worthwhile to try to position down one rib space or up one rib space until the image is optimized. Once you're satisfied with the image, the right ventricle can be seen in the near field here, followed by the interventricular septum. You can then see the aortic outflow tract with the aortic valve and the ascending aorta. The left ventricle is seen here with the apex cut out of the field of view. You then can see the mitral valve and the left atrium.
From the parasternal long axis view, you can also see the long axis of the individual mitral valve leaflets. This is the anterior leaflet, and this is the posterior leaflet. Here are the chordae tendidae extending off of both the anterior and posterior leaflet and going on to attach to the papillary muscles, which are not clearly seen in this image.
Pericardium is the hyperechoic line running circumferential around the heart. You can see the descending thoracic aorta just beneath the left atrium. For the parasternal short axis view, quite simply rotate the probe indicator from the patient's right shoulder to the left shoulder. Now you can see the left ventricle
And part of the right ventricle.
in short axis. We'll start more at the midline to see the base of the heart. And here you can see the aortic valve located centrally with the right atrium, left atrium shown here. You see the tricuspid valve, and then the pulmonary outflow tract, and the pulmonic valve. As you slide more lateral, you'll see the mitral valve come into view. It's often described as a fish mouth appearance. Now we'll slide from the mitral valve out to the papillary muscles. See the papillary muscles located here. We'll continue to slide and fan out towards the apex. Sometimes the apex can best be seen by sliding down one rib space and looking up, fanning out. However, in this case, it appears to be best seen in this position here. To acquire the apical 4-chamber view in standard cardiac orientation, you're going to place the probe just beneath the left nipple, with the probe indicator positioned somewhere between the stretcher and the left axilla. And you'll lay the probe over to the lateral position to look down the barrel of the left ventricle and see here, this is the apical four-chamber view. You can see the left ventricle here, the right ventricle here, the right atrium here. The left atrium is right here. You can see the mitral valve here, the tricuspid valve here, and you can see pulmonary venous return right here. By angling the probe anterior, you'll convert this into an apical five-chamber view. You can see the aortic outflow tract here with the aortic valve. To get a better look at the apex of the left ventricle, you may need to slide down one rib position and look back superior to get the apex. To go from the apical four-chamber view to the apical two-chamber view, you'll simply rotate the probe approximately 45 degrees up towards the axilla, and you will acquire a long-axis view of the left ventricle and left atrium, the mitral valve position here. But sometimes you may find it difficult to get the apical long-axis views, so you can ask the patient to lay in the left lateral decubitus position. That'll swing the heart into more of an anterior location and make it easier to acquire these images. You position the probe just below the left nipple, probe indicator pointing somewhere between the bed and the left axilla, and you can see the apical four-chamber view here. Again, the left ventricle, left atrium, right ventricle, and right atrium. You can see pulmonary inflow here. Now I've repositioned the probe down one rib space, and we can see the apex a little better here. To acquire the suprasternal view of the aortic arch, the probe indicator is going to be positioned towards the patient's left scapula, so somewhat of an oblique axis to the chest, and then you're going to insert the probe in the jugular notch and lie the probe up towards the head, and the aortic arch will pop into view. Now once you get the aortic arch, you can see here the ascending thoracic aorta, the aortic arch, and then the descending thoracic aorta. You can see the right pulmonary artery position here, and then you can see the branches of the aortic arch in the near field. More centrally, you'll see the brachiocephalic artery. The middle branch is the left common carotid artery, and the last branch is the left subclavian artery.